thank you all for being here. Thank you for listening to this important set of topics. So invisible symptoms are ones that are more difficult for other people to see. It's difficult sometimes to even explain those to other people who don't have MS. That doesn't mean that they don't have significant impacts on quality of life or your disability, but they're just not as obvious to the people around you. Everyone has a different experience with these symptoms. For some people, it's a small part of their MS, and for others, it's one of the biggest challenges that they might have, even after being on, high efficacy immune therapies. Hearing from me about these symptoms is maybe less useful than hearing from someone who has multiple sclerosis. One of my friends who has MS is also a doctor, was diagnosed during our training, and I wanted her to share a little bit about her experiences with these symptoms and trying to explain these to other people. She was unfortunately not able to be here, so we were able to sit down, talk some, and I wanted to show you some videos from that conversation. So we're going to see how well this works. This is kind of a different format than things we've tried before. You're going to be in a slightly weird position of watching me, watch myself, watch someone else. You might see me cringe a little bit because I don't like watching myself, but bear with me. Thanks for being part of this.
Thanks for having me.
If you could, tell us a bit about your journey into the diagnosis of MS and some of the symptoms. Can we turn up the volume anymore? Okay. Let me see. Over time.
Yeah, so
we may not be able to turn up the volume much more. And I don't think I can change it right here.
I was diagnosed back in February 2021. So doing the math, I was about 31 years old. And for me, it started with what I didn't know was MS, of course, at the time, but I had a lot of numbness and tingling. And I actually thought that I had slept, I knew I'd slept on my side for about 10 days because I had a small procedure on my back. And I thought maybe I slept weird and my arm went numb. And so, of course, then I let it go on for a couple months. And sometimes you know too much, and I thought, oh, nerves take time to heal when you sleep weird. And so I gave that time. I finally saw my primary care provider who did order an MRI without contrast of my neck, and it was for about a week later. And in that week's time, I started to develop numbness in my leg, the bottom of my face, and to my trunk. And so that's when I started to think, either I have something like multiple sclerosis, or I am an anxious mess who is believing that you have symptoms you don't have, or a brain tumor. I mean, the list was going in my brain. And so I went to get the MRI. The next morning, with technology now, it just resulted on my phone. So I'm sitting on my couch, and there goes opening the MRI, and it said that I had lesions, most likely something like MS. So it was very emotional. I called my friends from residency, including you and your colleagues who I trained with, to get some insight, and ended up going to the emergency department. I had more imaging, lumbar puncture, was ultimately diagnosed, had pulse dose IV steroids, and started on rituximab. And so when I was diagnosed, I had one inactive lesion in my C-spine, and then an active lesion in my C-spine, as well as an inactive lesion in my thoracic spine. Which, looking back, I remembered that during COVID, I actually, everyone was walking just constantly. And whenever I'd walk, my heels and feet would fall asleep. And I just always thought, maybe I'm sitting too much, I'm losing circulation, or these shoes aren't good. And I just ignored it because it was invisible. I didn't know. I just thought my feet kept flying asleep. And looking back, I think that was one of my first signs that I was having an episode.
It sounds like some of those early symptoms, some of those invisible symptoms, were kind of difficult for you, even as a physician who's very knowledgeable about many autoimmune diseases. Like, it was tough for you to conceptualize what that was or what that meant.
Yeah, it's really hard when you read these things in a textbook to then envision them in your own life. And I think I saw, I knew there's patterns in the brain and the spine, but it's very complicated. There's a reason you specialize to learn more about it. And it was a lot to process. I at times felt like I knew too much and it would make me more worried, or maybe I knew a lot but in a totally wrong field. And so it helped to rely on my peers, but I recognize that not everyone has that option.
Pause real quick.
So if that was difficult to hear, know that the full discussion is online. I'll have kind of the name of that at the end of this. There's a lot that we talked about that was important that we didn't have time to actually fit into this. And there'll also be times when I'm just talking and doing slides that aren't this. So if you're having trouble hearing, we will go through and kind of review some of the concepts that she's talking about. And then also why people with MS might have those, like what other things we think about for those, or how we, make sure that it's related to MS, and then things that we can do to try to help with that too. How have some of your numbness, the tingling that you had at the start, how has some of those symptoms, how do you experience them now, and how has that affected your day-to-day life?
I think now my baseline is sort of, a way I always try to explain it is if you go to the dentist and they numb your mouth because they're gonna take out a tooth, and then you leave and it has that fuzzy feeling that it's not still fully asleep, but it hasn't quite woken up. That's like if I touch my arm, that's what my whole arm feels like. And that's sort of baseline. I have that somewhat on my legs, a little on my other arm in different areas, but some worse than others. And then if I do activities like walk fast somewhere or get warm or work out or something, then I'll just feel that exacerbated. I think one example that comes to my mind is I do Pilates, and I'll go to this class, and so I have trouble with balance and also proprioception, so just sort of knowing where I am in space. And if I will do these balance things, and the women and men next to me are doing them so well, and I am just wobbling all over the place, and part of me wants to be embarrassed. I want to make an announcement, I have a reason that I can't do this. But at the same time, I think I've just had to learn to I have my own sense of pride that I can just say, it's okay. You're okay to wobble around when others aren't, and maybe they're having trouble with something else for different reasons. And maybe they didn't eat breakfast and they're just more tired than normal. And I think just remembering that everyone has their different reasons for maybe not keeping up in the same way they want to, and I don't have to explain that. It's not on me to have to explain to them why I can or can't do something. Another way that I have found support during this journey is through peer support. When I first got diagnosed, it seems everybody knows someone with MS. You just have to ask enough friends and you'll find some connection. But when I got diagnosed, I was connected with a couple people, and at first it's intimidating to reach out to someone and talk to them, but getting connected was really helpful. So whether it's a mutual friend or through the Rocky Mountain MS Center, getting someone to speak to who can relate is helpful, but also remembering that everyone's different. So just because the first person I talked to had vision problems and other things doesn't mean that I will, or because I have trouble with balance doesn't mean that they will. And so not scaring each other, but finding that support and that unity is helpful.
How have the people that you've met, the peer support that you've gained, how has that helped you with kind of understanding your invisible symptoms or finding ways to help with them?
It's helped a lot. I would say even just that mental burden, that invisible thought process that's often going on in the back of our minds, having someone else to say, have you gotten that vaccine, or do I need to, or I'm trying to go on this trip but I don't know if I need to get extra medications in case. I think that's been really helpful. Even people with other diseases that have chronic illness can be someone that you can relate to. But I think also just the symptoms in general, knowing someone else gets that feeling of, you know, I touch my own arm and sometimes I'm like surprised or just like kind of doesn't feel like me that my arm feels that way. And then I start thinking about how like that's not going to change, and so, or hopefully we'll get somewhat better, but there will be this baseline. And to have someone else who can understand that is helpful.
All right, so we're going to pause with the videos for a little bit and just summarize a little bit that Dr. Bloom was talking about, and especially that last clip about some of her symptoms. So, we'll go through a few different categories of invisible symptoms. So one of these is sensory, and that's what Dr. Bloom was talking about as some of the symptoms that led to her being diagnosed. So depending on where this is in your brain or your spine, this may show up as numbness or tingling. This may show up as balance or coordination difficulties or difficulties with your vision. For some people, this can also change into pain and pain from neuropathy. A lot of people will have this as being constant initially, kind of in the initial flare, and then as things start to repair, as myelin starts to recover, then they might notice it more intermittently in certain circumstances, especially with things that are kind of stressing the body in some way. The reason why this occurs in multiple sclerosis is when you've had injury to those nerves that are involved in sensation, in vision, or in the balance centers, then again, after the flare is over, after the inflammation is calmed down, there's still that period of time that your body is working to repair. And when you have your body has repaired it as best as it can, it may still not be 100%. So some people will tell me, hey, I don't have those symptoms of numbness anymore, but except when this happens or this happens. And it gets a little bit to some of the topics that Dr. Shaw talked about earlier with neurologic reserve. So if you have kind of a high neurologic reserve, then when your body or your mind is under like a stressful situation, you may not have these symptoms from the injury come out. But if that's a little bit lower, then as things are stressing your body, stressing your mind, this can start to become more prominent again. And it is usually something that's temporary, like you take away whatever that physical stress is, whatever that emotional stress is, and then it can improve again. I think some people talked about that a little bit earlier at the Q&A with pseudo exacerbations and a little bit about what that is. But that's kind of related to this concept of those stresses kind of resulting in those symptoms coming back again. When we have this in multiple sclerosis, depending on what's going on, we might talk about, well, maybe we should kind of recheck some spine MRIs or some other MRIs to make sure that something else isn't going on. There's a number of times that numbness or tingling, especially in your limbs, can also be from something outside of MS, related to your discs or kind of pinched nerves from your spine, sciatica. We might be doing some blood tests to look at electrolytes or other causes. People who have MS are still at risk for the other things that can cause difficulty with your vision, like glaucoma or retinal detachment. And so depending on what the symptoms are, it may be kind of making sure that there's not something else going on related to that. Treatments for this. So also similar to what Dr. Shaw said earlier, physical therapy, occupational therapy, even though that's mainly focused on working muscles, it's working still the same nerve pathways that are involved in sensation. And so by working those, like that encourages regrowth, that encourages kind of repair. And so a lot of times that can help with recovery or improving symptoms. Sometimes you can pick out very clear triggers, like whenever you get sick or whenever you're overheated. And this was something that Dr. Bloom talked about in a different part of this set of videos. But for her, like having cooling blankets at night was something that was important for her, because otherwise she'd wake up in the middle of the night with tingling or numbness, and same kind of in the morning. And so those were some of the things that helped her specifically. If there's pain that's involved, there's different pain medicines and techniques that can be helpful. Some of these are medicines by mouth. Some of these can be topical medicines. And then there's also avoiding medicines. So I've had some people do cognitive behavioral therapy that kind of helps retrain the mind as far as how you think about or how you experience the pain. And I've had some people say that acupuncture or other things is useful for them as well. A lot of times the treatments for these invisible symptoms are not the same for every person. Everyone is their own person. Everyone's MS is unique to them. And the treatments or the things that help them are different from person to person.
One of the other kind of very common invisible symptoms I hear about is fatigue, both kind of a physical fatigue and kind of like a cognitive fatigue. Have you experienced any of those since you've been diagnosed?
Yes. And I think even that's been a journey to accept that I'm feeling that. I know who isn't tired, and fatigue is such a generic term that can come with mental health and so many other reasons to be fatigued. I think I've struggled to really tease that out, which goes back to that self-doubt and questioning of myself. But when I think about fatigue, I feel like it's very hard to explain, but those who experience it understand. It's like I might have slept great and I'm just sitting doing work, and then suddenly it's like I have this weighted blanket over my eyes and I want to be awake, I want to be working, and I just can't keep my eyes open. I just feel like all I could do is sit back, fall asleep sitting up, take a power nap. And so it sort of hits when you don't expect it. And I think also after you've been in the heat, which a lot of us can't help, depending where you live. And you might power walk to a meeting because you're running late in the heat, and then you get there and then suddenly you just feel this wave of decreased energy, and it can be really hard to push through. It's also one of those things that you can't really explain, and then you don't know how to navigate that, where you feel tired, well, so do they were up with their child, and it just, as you said, there's this physical fatigue, and then there's that mental fatigue, and I think I can tell the difference of when my brain's just not processing at its normal speed and when my body needs a break.
What are some of the things that you found that helps with either of those things that have worked for you?
Yeah, I think one thing I found is not fighting it, which we don't always have the opportunity to do. But if I'm home and I feel this, I just try to push through, and I'm literally typing and I'm just falling asleep every other word. And sometimes I just have to let myself take a break. You can set a timer, let my eyes close, and just get that refresh, which can be really helpful. I think otherwise prioritizing sleep as much as you can. And one thing that I find helpful that I hear people talk about is something called the spoon theory, but essentially is everyone's given a certain amount of spoons in their day, and maybe for someone walking to that meeting and rushing to that meeting takes 1 spoon of their allotment, and maybe for me or someone else that takes 3, and we only have so many spoons in the day. So I think planning ahead and knowing some activity is going to use up more of the energy bank that I'm allotted each day is helpful in terms of pre-planning and just setting your expectations. Another thing that sometimes I struggle with is how far to push myself. So I'm told for fatigue and for things that exercise is really helpful. But then if you over-exercise, then you're more fatigued, and it's just hard to find that balance. And I'm still learning that. And maybe I'm fatigued because I pushed too hard, or maybe I'm fatigued because I'm not doing enough. And that balance has been a little tricky to navigate.
That adds even more to the cognitive.
Yeah, exactly.
All right, so fatigue is probably one of the main symptoms I hear about in my clinic. And so there's multiple types of fatigue. So, some people will describe their fatigue more as cognitive. So their mind feels overwhelmed or exhausted. It's difficult to spend long times in focused activities. And some people will describe more of a physical fatigue, just having less physical stamina, needing frequent breaks to rest in activities. And some people notice that they need naps more often, that they feel like they need more sleep, or that their sleep doesn't restore them as much as they would like. And some people, this is a big change for them in trying to avoid or plan out their activities, and kind of noting that they feel like they're paying for it after they're doing a fun activity. So in MS, the injuries in MS, the myelin demyelination, that changes how easily nerves can send signals from one part of the brain to the other. And your brain is sending a lot of signals back and forth that aren't just going to your muscles, to your touch sensation on your skin. And so even just like thinking can feel like more exhausting, because thinking or moving may take more energy than it does for other people as a result. One of the things that Dr. Bloom mentioned in a different part was that there's also the fatigue of dealing with organizing appointments, having a disability, or monitoring your own body's symptoms. So there's kind of extra thinking that goes into planning out things with your MS, or taking care of yourself with your MS. When we talk about this in the clinic, we want to make sure that there's not something else going on. So thyroid disease can also cause fatigue, anemia, infections, sleep issues, mood, and other diseases. And so we may be doing blood tests or other things to try to look for those other things that might be mimicking the fatigue in MS. Some of the treatments for this, in general, and you heard this a little bit earlier with like optimal lifestyle with Dr. Shaw, but in general, what keeps your body and your mind healthy helps with fatigue, helps your body and its nerves like work optimally and work with kind of the least amount of energy possible. It's not expending extra energy, worrying about something related to anxiety, or it's not, spending extra energy to fight off some infection or, fight against the poor sleep. And so healthy diet, balanced exercise, which is easier said than done. But as Dr. Shaw kind of gave specific examples of, those are some of the things we know help out the most. And honestly, that's what I've seen help the most with a lot of my patients. Sometimes we'll use certain medicines. So you may have talked about this with some of your neurologists in the past. Modafinil, amantadine being some of the most common ones. And then there's different supplements that we don't have any studies that show that they're definitely the answer, but that people have found or tried. And again, this is kind of different for each person.
I think it's one thing to hear about all these symptoms and know what's expected and what's not, but it's another to have to actually process that debate in your head every day and not just feel disappointed. Like, I know something might leave me more tired, but then it's how do you deal with that and respond to that? I think for me, it's sort of a question of acceptance. I think you have to accept that this is something that is true. This is a fact. We unfortunately can't take away the disease, but we can also accept that it's okay to be disappointed. It's okay that that's not ideal and that you need to get comfort sometimes. It's okay to be nervous, and also accepting that it's a journey. You might not be able to accept or be okay with those things today or tomorrow, or maybe you are, but then you go a little backwards. But I think having support systems that understand you're gonna ebb and flow will be really helpful for that. I think for me, I'm a little anxious at baseline, and I think this just adds to that. And so some things I have to work on is, one, I'm all for having a therapist and seeking mental health support just for an outside person to know I can discuss these things with. There's always that balance with my husband of, I want to complain, I want to say I'm worried about something, but I also don't want him to then worry that I'm going to get worse or this is going to be a problem. So there's that fine line. So I think having an outside source can be really helpful. I find helpful using a weighted blanket can be somewhat soothing when you're stressed. And speaking of blankets, when I was diagnosed and had more active disease, and even now, I find a cooling blanket in my bed can be really helpful. So it's under me and it has cold water that runs through it, and that just helps me from waking up hot and numb. Another thing that I find helpful is just, my brain is all about thinking about the unknowns, and it wants to just process it and worry. And I've learned the skill of saying, you know, maybe that's the case or maybe it's not. And your brain sort of doesn't have anywhere else to go. So maybe you're going to struggle with that activity or maybe you're not. But unless you do it, you're not going to know. And so just trying to repeat those back to my anxious brain, and just knowing I'm accepting what's happening, but I'm committed to doing what aligns with my values, and as much as that's safe, trying to do that.
And I think we're coming up to time here soon, so I'll try to kind of go quick through a few of the other common invisible symptoms that we hear about. So as Dr. Bloom was talking about, anxiety, depression, these are kind of things that we know happen more often in anyone who has a chronic disease or disability. In MS, like the injury, the inflammation, you know, it's changing some of the brain signaling and kind of between the parts of your brain. And your brain, to work optimally, has kind of a balance of all the chemicals and all the connections between it. And so if there's injury, then that can throw some of that off. And so it can make it easier to have depression or anxiety. The treatments for that, same thing, keeping your body and mind as healthy as possible. There are therapies that can be helpful too, like cognitive behavioral therapy. And sometimes antidepressants, anti-anxiety medicines can help with kind of rebalancing some of that imbalance. Another thing that I often hear about is cognition. We talked about this a little bit before with cognitive fatigue, but for some people, this is feeling that your thinking or processing of things is slower, might be more trouble finding words or your memory. And in MS, like we talked about before, because some of the signaling is slowed down, some of that insulation that helps the signals go through are slowed down, it is kind of slowing down processing. And when you're kind of thinking, especially kind of detailed thoughts, it can take a lot of nerves to think or process, so you start to notice that more. We'll usually check other things as well that might be related, but have very different treatments. And there are different things that can be helpful for training that. We definitely didn't have time to go through all of these different ones, but we know that there are other invisible symptoms, and there are other things that we can do to try to help with those. And then lastly, just some resources, reach out to your primary doctor if you're having these, talk about things that might be helpful. The Rocky Mountain MS Center, the Job Accommodation Network, can help with trying to explain some of this to your job or your occupation. And then the complete interview for this should be uploaded maybe now to the MS Center's YouTube page if you want to hear more about this.